thank you very much. I wasn't expecting that. And as you can see, my voice hasn't improved from those of you who heard me earlier today. Though I gather there's a very good Indian GP who's going to attend to me later. So thank you for that, Nidhi. This is a fantastically key topic. This is absolutely essential. The shortest supply in the world of health now is not money, it is skilled health workers. People die or are disabled all over your country, all over Africa, all over the world for lack of access to people, sometimes with the most basic knowledge. That's the biggest single issue that I think we face in healthcare today. And as I said this morning, I think a large part of the answer to that is about people working at the top of their license. In other words, doctors doing only what doctors can do, nurses doing only what nurses can do, and so on. And we need to change some of those boundaries. Let me just give congratulations to the KPMG group who wrote this report, which most people won't have seen yet. It has 4 themes. I think they're very prescient themes. The first one is the obvious one of strengthen the workforce. The second one is less obvious. It's empower the community. It's the community doing more for themselves. The third one is promoting self-care. And the fourth one is leveraging technology. What I'm going to do is not talk about those themes in particular, but actually pick up 4 points, which are all about reform, as we've just heard about. They're all about actually changing the way we think about this problem. There are no absolutes. There is nothing that says this is absolutely what a doctor has to do or what a nurse has to do. In my country, I know that those are all the results of negotiations between professional bodies and governments. You know, these are movable in the right circumstances. So my 4 points are starting off with the one about strengthening the workforce. And I would encourage people to go even further with the debates that have been had here in India and very notably in Africa as well, about changing skill mix, about actually changing who does what within the system. And to push this very hard. You've got some wonderful examples here in India of people doing things which have not been done by, if I may put it like this in inverted commas, the traditional professions. Regulation needs to be flexible enough so that these changes can be made safely, but that they can be made. And that's quite a delicate balance to get. Let me give you one example from the UK, which is probably the biggest example of skill mix change in the world. In the UK, we have 50,000 GPs, and we used to contract them to the NHS as individuals. We now contract them as practices. The net effect of this is that we will contract the practice of 4 GPs to do a range of services. The net effect of that is that they don't do them all themselves. And actually what's happened in the last 15 years is that a GP used to do 100% of the work, but now if you go to a GP surgery in the UK, they're probably doing about 50%. They've employed nurses, they've employed counsellors, they've employed all kinds of different people to do it. And the really important lesson from that is that this will happen when the professionals lead. That is, I think, the most important point, that we need to be trying to make these changes in skill mix under the leadership of doctors and nurses and others, and that those people will make that happen. Let me just mention one other thing. I don't know if it was on the list, but I co-chair a group in Parliament called the All-Party Parliamentary Group on Global Health, which is 70 MPs and Lords interested in global health. And we do a couple of reports a year. We did one called All the Talents last year, which actually looked at skill mix around the world, including some in India. And what we knew, of course, is that most skill mix changes of this sort fail. So we wanted to know what were the reasons for success. And the reasons for success were terribly obvious. They're actually on the front page here. You start by getting leadership and planning right. If you decide that, for example, as we did in the UK, that we wanted our nurses to be able to prescribe many common drugs. So we now have advanced nurse practitioners who prescribe many of the common drugs in the UK. Leadership and planning, design the job properly, recruit the right people, train them, retrain them, provide supervision and referral, and provide teamwork. Terribly obvious. And we looked at all the examples that worked, and they're all like this. And if you look at Aravind and the way that they operate with their different groups, then actually they've done all of this. and you look at any of your other innovative people in this country. If you want to fail, turn it upside down. Terribly simple. If you happen to think this is a bad idea, then just make sure, fail to provide leadership, fail to design the job properly. But you can see that works. So that's my first point. There's some evidence now about doing this. You can redesign the workforce. The second big point is central to this, is professional leadership and education. We are still in our country and in your country educating professionals for the 20th century and doing it very well for the 20th century. But the point about the 21st century is what people have been talking about all day, is the 21st century is different. You've got these long-term conditions, you've got the three very interesting disruptions, which the last speaker pointed out. You've got a different world. I was a member of something called the Lancet Commission on the Future of Professional Education. It said three core things that I think are relevant here. First is that professionals need to understand systems. 100 years ago, doctors learnt about science with the Flexner changes. 1910, the science-based medicine came in Western medicine. In the 50s and 60s, we moved on to problem-based medicine. In other words, looking at the individual patient. The 21st century doctor needs to understand the system if you're going to have an impact for your patients as a whole. The second point it made is that doctors need to work trans-professionally and not just interprofessionally. They need to work with the whole team, including the patient. And the final point is that the doctor of the future, the clinician of the future, is going to be an agent of change. The really successful ones. They're going to be the team leaders who make things happen. They're not only going to be the hands-on people, but a lot of the hands-on can be done by other people, but doctors have that special skill and ability to move things and make things happen. The third point I want to make is the point about empowering the community. And this is a fundamental point that sometimes gets missed. And it's this: unless you've got a very good tradition in India, as in many countries, of self-help and families helping people and so on. The sustainability of your health system as it is today and its sustainability in the future depends on maintaining and developing that tradition. Let us suppose all the informal care disappears, then it will all fall on the formal health system. And there's no future in that. And actually, as you strengthen, and this is why I think the KPMG team have done a very good thing, you need to strengthen the community and the informal networks of care in order to be able to also strengthen the formal networks of care. And then my final point was the point on leveraging technology. I think today we've mostly talked about leveraging technology, or for the Americans, leveraging technology, in terms of IT. But actually we need to think in terms of biomedical science as well as IT. We need to think about point-of-care treatments. We need to think about the home monitoring stuff where actually patients do things for themselves and not just the IT systems. It's about where medicine is taking us as well as about where IT is taking us. So 4 simple points I would use just to do my bit of introduction here. The first one is there is evidence now, and this is an example of it, of how you can successfully change skill mix or task shift or whatever language you want to use. Crucially, that depends on doctors leading. My second big point is professional education. You need to change the way in which you think about the education of your professionals and change it for the 21st century. It's not more of the same. It's not suddenly, doubling, quadrupling the number of doctors, but doing it on the old curriculum and so on. And I think there's a role here, possibly for this group, but for somebody to do the sort of Lancet study on India and actually come up with what the future looks like in terms of professional education, what you need to have for the future, because it isn't going to be like the past. And then thirdly, this point about continuing to empower the community, because the sustainability of the health system depends on the informal networks as well as the formal ones. And my fourth simple point is leveraging technology is about biotechnology as well as about IT. I very much look forward to hearing Mark Britnell and the panel getting their teeth into this and taking us further forward. Thank you very much.